This video is about PharmaJet's needle-free jet injection technology that can be used for delivery of liquid medicines and vaccines intramuscularly or subcutaneously in a 0.5 milliliter volume. You'll need the following materials for this Stratis educational video: PharmaJet Stratis injector, reset station, vial adapter, needle-free syringes, rubber ball, vial of non-sterile saline for injection into the ball. When you are done with this video, you should be able to properly prepare the injector, accurately fill the syringe, properly load the injector with the filled syringe, successfully administer the injection to the patient, and dispose of the used syringe. Step 1. Prepare the injector. The first step in using the PharmaJet Stratis injector is to prepare it for use. In this step, the reset station is used to charge the injector. Fully open the lid. With the PharmaJet logo facing up, insert the injector nose first, then lower the back half of the injector into the recessed area until fully seated. Place one hand on the end of the lid and push down firmly against the resistance until the lid closes completely. The lid will then partially lift, indicating that the injector is charged and ready for use. Remove the injector from the reset station and close the lid. Check to see that the injector pin is recessed, indicating the injector is charged. The prepared injector can be placed on the counter until you load the injector in Step 3. Step 2. Fill the syringe. There are two vial adapter options: the larger 20 mm universal adapter and the smaller 13 mm. When using the 20 mm vial adapter, remove the protective sleeve from the spike. The spike is recessed on the 13 mm vial adapter, so there is no protective sleeve. To transfer the solution from the vial into the needle-free syringe, remove the blue protective cap from the syringe. Attach the needle-free syringe to the vial adapter by pushing the end of the syringe down into the top of the vial adapter and twisting clockwise to lock it in place. Being careful not to touch the spike, align it into the center of the vial rubber stopper. Next, with a downward twisting motion, insert the vial adapter into the vial until it is fully seated. Ensure the holes in the vial adapter spike are below the vial stopper. Use standard procedures for pressurizing the vial prior to drawing the fluid if necessary. Do not attempt to use a partially filled syringe. Invert the assembly and pull down on the syringe plunger to draw fluid into the syringe, removing air bubbles as required. Draw down the plunger to the point where the red O-ring is slightly beyond the fill line. The 0.5 milliliter fill volume is automatically set when the syringe is inserted into the injector, so a slight overfill at this step is preferable. While keeping the entire assembly inverted in your hand, snap off the end of the plunger at the neck with a bending, not twisting motion, and discard. Step 3. Load the injector. Pick up the charged injector and with your thumb depressing the multifunction button, orient the injector with the blue ring pointing upward. Insert the base of the filled syringe into the injector until you hear a click, locking it into place. Any overfill in the syringe is purged back into the vial during this step. Keeping your thumb on the multifunction button, re-invert the assembly so the vaccine vial is now upright. Then remove the syringe and injector assembly from the vial adapter with a counterclockwise turn. If you are using a multi-dose vial, cap the vial by attaching a new syringe into the top of the vial adapter. Step 4. Give the injection. Practice. Before injecting patients, please practice using the rubber ball provided with your starter kit. Remove your thumb from the multifunction button and engage the rubber ball by pushing the syringe against the injection site at a 90-degree angle. Apply gentle pressure until the blue retractable ring is fully depressed. Depressing the ring fully releases the safety. Now, while maintaining a steady pressure against the injection site, press down on the multifunction button to inject. A click will be heard upon injection. Removal of the syringe from the injector is accomplished by pressing inward on the ejection button under the injector. Dispose of the used syringe per standard procedures. It is not necessary to recap the needle-free syringe prior to disposal. Before injecting a patient, this process should be repeated until you feel confident. Patient injection. Patient assessment and preparing the injection site location should be performed per Centers for Disease Control guidance. Prior to the injection, it is suggested to say to the patient, "Listen for the click." Once you hear the click, the injection is complete. For an intramuscular injection on an average size arm, push straight into the most muscular section of the deltoid muscle at a 90-degree angle, assuring proper intramuscular delivery. An arm with more adipose tissue may require increased pressure to adequately place the injection into the muscle. In an arm with little to no adipose or muscle tissue, you should bunch up the muscle to limit the depth of fluid penetration. For a subcutaneous injection, pinch or tent the skin and inject into this elevated skin as you normally would while maintaining the 90-degree angle. This limits the depth of penetration and assures proper subcutaneous delivery. With a normal-sized adult arm, the standard technique for injection is into the subcutaneous space over the posterior triceps muscle. This technique is the same regardless of adipose tissue quantity. Remove your thumb from the multifunction button and engage the patient by pushing the syringe against the injection site at a 90-degree angle. Apply gentle pressure until the blue retractable ring is fully depressed. Depressing the ring fully releases the safety and allows you to now press down on the multifunction button to inject, while maintaining a steady pressure against the injection site. A click will be heard upon injection. Immediately apply pressure with cotton or gauze to the injection site for approximately 60 seconds, and then apply an adhesive bandage. Removal of the syringe from the injector is accomplished by pressing inward on the ejection button under the injector. Dispose of the used syringe per standard procedures. It is not necessary to recap the needle-free syringe prior to disposal. When the injector is not in use, the reset station can serve as a storage device. With the lid open and at a full 90-degree angle from the base of the reset station, insert the injector nose first into the recessed area. Lightly pinch and lift up the two metal arms on the reset station, and maintaining that upward pressure on the arms, gently close the lid. If you feel resistance, start again. The lid in this resting state should fully close without charging the injector.